Hello, my name is Nicholas Yunez, and this is my video for Project 3 for WRA 110, Section 733. I would like to discuss electronic medical records and the HIPAA privacy policy and how they relate to my role in the research project that I am a part of here at MSU. The first thing I would like to show you is this sign that is present in the elevators at Sparrow Hospital. As you can see, this sign says, "Please exit elevator when stretcher is present to protect patient privacy." This serves as a preliminary precaution to assure the patients that are admitted into Sparrow Hospital privacy at all times. Next, I would like to discuss what HIPAA is. HIPAA stands for the Health Insurance Portability and Accountability Act. It implements regulations for the use and disclosure of one's health information. The two main aspects of the privacy policy that I would like to incorporate in my video presentation is that it gives patients control over the use of their health information, and that it defines the boundaries for the use and disclosure of health records by coveted entities. The next thing I would like to discuss is the process that I go through when I am presented with a potential participant of the research program. A potential participant of the program usually is a nursing mother in her first trimester checkup. The first form that I present to this potential participant is a consent form. This consent form contains information regarding the background of the study. It contains information regarding the purpose of the study, risks that are involved with being a participants of the study, which in this case are next to none, and then most importantly, information regarding how their confidentiality will be protected. She needs to sign and date this form before we can proceed to the next form. The next form that I present to her once we finish with the consent form is the actual HIPAA form. This HIPAA form contains personal contact information, as well as this information that says that it gives authorization to the research program to be disclosed to help to her health information. On the back of the HIPAA form, it states the expiration date of her involvement in the program, which is usually 5 years from the date of registration, and then followed by her signature and my signature. The back side of the form also contains the name of the principal researcher, as well as the name of the clinic that we are conducting the actual process. After I have obtained both of these consent forms and both of her signatures, and as well as my signature, I can move on to the next form, which is this questionnaire. Now, when I present this questionnaire to her, this is when I am disclosed to her most sensitive information, both personal and health-wise. The types of information that I am disclosed to are her date of birth, her social security number, her baby's estimated date of delivery, her race, her highest level of education completed, her marital status, her yearly income, her height, her weight, and in my personal opinion, the most sensitive information that I am required to ask of them is, was this pregnancy planned? To many women, that is a very personal question, and to myself, I feel uncomfortable asking them, but it is my responsibility as part of the research program to obtain this information. Aside from this information, she is also subjected to fill out this brief history of psychiatric disorders. Most women leave this area blank because they either don't know or are too uncomfortable to release this type of information. Once she has finished completing this questionnaire to the best of her knowledge and ability, I can then move on and conclude the presentation to the participant with her $10 Meyer gift card. Once we are finished and have concluded with all the paperwork, and she has continued with her prenatal checkup, I can then enter this information from paper form to electronic form. I have printed out the screenshots of the program that we use to incorporate this information into electronic forms. The program we use is called RICS, and it pretty much breaks down every question that is asked on the questionnaire into an electronic Dropbox, where I just convert it simply from paper form to electronic form. The one screenshot that I would like to show is what the questionnaire form looks like electronically. It's just drop-down menus with the answer that the woman provided, as well as any other additional information that she has also incorporated. Once I finish incorporating all of her personal contact information and the limited health information that she has disclosed to me, I can then move on to the two types of biological samples that we collect from her, which are her urine and her blood. I have no involvement in collecting these samples. All I have to do is transport the samples from the clinic to the appropriate refrigerator, which then they are then transported to MSU. That is the only handling I have, as well as training I have with these biological specimens. So once I have concluded that all her information has been correctly electronically updated, I had confirmed that her two types of biological samples, her blood and her urine, have been collected, that they are here, and that they have been placed in the appropriate refrigerator, and that they are ready to be transported to MSU. Once I have confirmed all this information electronically, I activate her status to active participant, and she is now an official participant of the research program. This is, in the most condensed way possible, the process that I go through when I am presented with a participant, and where we go from collecting her information as best as we can and as quickly as we can using paper form, and then we convert it to electronic forms so that the actual researchers that are using this information can access it as quickly as possible whenever they need to, and with as little problems as possible. I hope that I have educated you in some way regarding the privacy policy that I must follow to guarantee a patient privacy at all times. Thank you, and have a good day.